Okay, we're continuing with Hidden History of Health by me, Pete Rogers. We're going to be talking about Alzheimer's and dementia today. This book right here is by Jack Torre Phd out of Texas. And what he did was tied off the carotid artery in a mouse. And then he found that the mouse would go demented. Middle-aged and older mice would be demented within 2 months. He did an autopsy. When he opened up the skull, they expected a stroke on the same side. He tied off the carotid, but there was no stroke. The brain was just shrunken. And he tied off both carotids. The brain shrinks on both sides. Tied off the arteries in the back, the vertebral arteries. The brain shrinks in back. Whatever territory he tied off, including the middle cerebral arteries, that part of the brain shrank and became atrophic. Now you have to remember, we're talking about tying it off proximally, distal from where the brain becomes ischemic, has a lack of oxygen. So this is not the same as a stroke. A stroke is a distal artery right next to the brain tissue that blocks all of its significant blood flow and it just dies fast. Whereas what he's doing, he's tying off the major artery to, let's say, the right side of the brain, but there's still collateral flow coming across the middle and from the back, so the brain doesn't die out suddenly. There's no big sudden stroke. Okay, the point I'm telling you all this for is that, one of the things I do is I'm a neuroradiologist, and I look at many tens of thousands of brains, and I don't see the so-called Alzheimer's pattern of, parietal lobe and medial temporal lobe atrophy. That's BS. It's nonsense. There really is a genetic Alzheimer's, but the so-called sporadic Alzheimer that they claim to be more common, I think it's nonsense, okay? They can't diagnose it while the patient's alive. They can't diagnose it by a historical question, taking a medical history, physical exam, or a blood test. And the imaging to diagnose it is unreliable as well. And then even an autopsy, they're not certain because there's so much overlap with other conditions like Parkinson's disease, for example. And then they have no treatment. What would you call a disease for which you can't diagnose it when the patient's alive, you can't diagnose it when the patient's dead, and you have no treatment? You would call that a BS disease, okay? So anyways, Jack Torre figured out how to make mice demented. And your first thought will be, so what? He tied off the carotid. What percentage of patients have an occluded carotid or a severely stenotic carotid? Not that many, okay? Fair enough. But now let's think about it. I don't see one little segment of the brain atrophic. I see the whole brain atrophic, especially bilateral frontal lobes, and the parietal lobes, temporal lobes as well. Okay, but what's my point? This is diffuse cerebral atrophy. And in real life, who gets global hypoperfusion, global lack of blood flow? A patient who has hypertension and you overtreat it. Why do you have a blood pressure? To pump blood to the top of your brain, your cerebral cortex, to pump that blood against gravity. So that's why your pressure is high in the first place. And if you just take a pill and drop that pressure a lot, you're hypoperfusing your brain. You're potentially going to cause dementia. Well, that's why all these old people fall. The most common reason these old guys fall, I see hundreds, countless of head CTs from emergency rooms, and the history is always the same. Old guy fell, hit head. Old guy fell, hit head. BHT, blunt head trauma. Okay, because they're overtreated hypertension. And drug companies keep wanting to lower the threshold to treat, so they make more money. All right, see, so there it is, overtreated hypertension. And if you don't treat the hypertension at all and it's severe, it damages the arteries of the brain and you get intracranial hypertension and you decrease the oxygen delivery to the tissues because of that. So you're damned if you do, damned if you don't. You want the Goldilocks mean, the Aristotelian golden mean. Not too high, not too low. How do you get that? Low-fat, plant-based diet. That's what smart people do. Okay, what else? How about atrial fibrillation? Tons of people have AFib. 25% drop in cardiac output. Hypoperfusion, potentially. Okay. How about congestive heart failure? Tons of people have that. How about keeping the patient hypotensive in the post-op phase after a CABG, coronary artery bypass graft, because you don't want them bleeding at the anastomoses? Very common. I call those mouse equivalents. They're like the mouse. Aortic regurgitation, aortic stenosis. Hypoperfusion, cerebral, like the mouse. All right, so you can see there's a lot of things that cause hypoperfusion. So what kills a brain cell? So normally here's your brain cell. It has a workload placed upon it. It has to meet its workload or metabolic demand. It has oxygen and glucose delivery. That's the blood flow. If you drop the oxygen and glucose delivery due to overtreating the hypertension or the other reasons I just said, you put these brain cells at risk. When a brain cell runs too low at energy, the immune system eats it, removes it, okay? So you don't want that. But then simultaneously, lots of people overstimulate their brain cells, give them a stimulant, also called an excitotoxin, like caffeine, psychological stress, sleep deprivation, artificial sweetener, aspartame. High-fat diets also lead to this because they cause increased beta-amyloid protein in the brain. Okay, these are just some examples of it. So now you got a widened gap. Not good. All right, if you have leaky gut, you also get increased amounts of this. All right, I'll explain that in previous other lectures. But now the other thing too that I figured out the whole thing, besides what we're just talking about and the toxin issues, is mitochondrial inhibition. So this cell, it's really an energy crisis, has to make a lot of ATP. If it can't make that ATP because its mitochondria don't work, it's going to die. All right, and I found over 120 mitochondrial inhibitors. There's zero. I own 8 biochemistry books. There's none of them in all my biochem books that are taught in college, med school, nutrition schools. But there's tons of them in the literature, and they're real common. Tylenol, most antibiotics, antidepressants, tricyclic selective serotonin reuptake inhibitors, metformin. Okay. It goes on and on. Statins, aluminum, fluoride, BPA, cadmium, lead. Okay. So anyways, that's the great Jack Delatorre book, sort of like the introduction, the big introduction, key thing to get. Here's Asian atherosclerosis versus Western atherosclerosis. So when I say Asian atherosclerosis, you're talking about like the Japanese in the 1960s, eating tons of sodium, 12, 14 grams a day, smoking cigarettes like a chimney. So even though they ate a low-fat diet and they didn't get much coronary artery disease, they would get intracranial atherosclerosis. So hypertension alone, isolated hypertension, causes a lot of intracranial atherosclerosis, predisposing to increased risk of stroke. Versus Western atherosclerosis, high-fat diets get a lot of coronary artery disease. Okay, here's just a picture I was referring to about mouse equivalents with the Delatorre work. Like I said, AFib, CHF, congestive heart failure, overtreated hypertension, aortic stenosis, aortic regurg, postoperative CABG, coronary artery bypass graft, hypotension. I call them mouse equivalents. And I look at tons and tons of brains. By far the most common thing I see is a diffusely atrophic, meaning diffusely shrunken brain because of this stuff, apoptosis. And you also, EMF, electromotive force, like cell phone, Wi-Fi, that's a mild stimulant, okay? Putting a kid on attention deficit meds, that's a stimulant. That's going to increase the risk of brain cell damage. Okay, let's see what else. Oh, this is just showing the capillary, that basically if you have a damaged capillary, normal capillary right here, the red blood cells traveling through the capillary, the blue circles are the oxygen being delivered to the tissue, in this case a neuron, a brain cell. Okay, if you have hypertension, you thicken the vascular smooth muscle layer around it and you get collagen fibrosis in there as well, decrease in oxygen delivery. Diabetes, you thicken the capillary basement membrane, increasing the distance the oxygen has to travel to get to the cell, making it less able to do so. And so you cause tissue hypoxia. So you're having an effect similar to a mouse equivalent. And this is what I meant by hypertension. Damned if you do, damned if you don't. But I'd be more scared of hypotension than hypertension. People say, oh, well, you have real high blood pressure, you could have an intracranial bleed. Yeah, right. I look at brains every day, and I can tell you, I hardly ever see an intraparenchymal hematoma. Yeah, they happen. I see one every couple of months, maybe about one every 6 months. Whereas I see fell-hit head all day long every day. So I'm more scared of hypotension than hypertension. Okay, like McDougall said, McDougall would have a threshold to treat systolics of 150 to 160, whereas other people will be treating with much lower systolics. And I see these old people, they come to me, oh, my blood pressure's under such good control. It used to be 170, now it's only 120. And I'm like, I'd be a little scared of that. Sounds kind of low to me. Okay, maybe you needed it to be a little higher to perfuse your brain. This is just a more detailed diagram, okay? Like a river, at the dock unloads its product. The capillary unloads its oxygen, and it has to go through all this stuff. It has to go through the basement membrane. It has to go through the extracellular matrix. It has to get in between the endothelial cells. It has to get past the vascular smooth muscle cells. All kinds of things can mess this up. The obvious things like tobacco, advanced glycation end products thickening the basement membrane, lack of vitamin C damaging the collagen, glyphosate on processed food damaging the collagen, tobacco damaging the collagen, alcohol damaging the collagen. Okay. Fluoride damages collagen. These are all examples of things that will decrease that ability to get oxygen to that cell, and it needs that oxygen to make the ATP energy. Okay, so that's it for today. The main point was the Delatorre vascular hypoperfusion undersupply theory of dementia and everything that relates to it. And then we got into my Peter Rogers supply and demand theory of dementia as well. Hope you found that helpful.